Okay, so my name's Nick Vanta Hayden. I am the compere and host for the session today. We have a very packed agenda, so I am going to be as strong as I possibly can so that we stick to the time. I think that's it from my side. I want to leave as much time for all the important people on this call as possible, so I'm going to hand over to Jim, who's going to make some general announcements. And I know that Linda will give us a little bit of an intro or a brief introduction or discussion on the the next meeting that we have scheduled. So Jim, over to you.
Thank you very much. And Nick, thanks for hosting all this. Let me just say, I love getting credit for work that other people have done. So I'm strongly in favor of that. But I didn't do the work for this week's or this month's program. That was done by Phil Bienhauer, who helped us get Dr. Brian Anderson to talk about what MITRE's doing, and by Joyce Hunter and Orlando Lopez, who are going to be moderating the main part of the program. So thanks to them and to our speakers. To introduce Dr. Anderson, he's a physician executive with MITRE. He has operational, programmatic sales, and strategic leadership experience. He's got a Bachelor of Arts from Harvard and a medical degree from Harvard Medical School, and did a pediatric internship at Mass General. So Dr. Anderson, thanks for taking time to speak with us, and let me turn it over to you.
Thanks for that introduction, Jim. And Nick, would you like me to drive the slides, or Jim, would you like me to drive the slides, or will you drive the slides? You're on mute, Nick.
He's on mute. Why don't you do it, Brian?
All right, great. I'll go ahead.
Well, look at that. I'm the first to screw up that way. No, I'd like you to drive it. I'm here as a backup.
Very good. Hopefully everyone can see my screen now. So back in March of this year, MITRE began fielding a number of calls and inquiries from a variety of stakeholders that we have that we partner with on a variety of projects, including a number of companies that were interested around how can we come together collectively to address the pandemic, which, if you recall, back in March and February was really just beginning. And so my leadership under Dr. Jay Schnitzer, along with my mentor and colleague from Mayo Clinic, Dr. John Halamka, we sat down, and in about a couple of hours, we agreed that this was something that MITRE should stand up, a program management office to help facilitate and enable private industry companies to come together to try to make a difference in this fight. And so that was really how the COVID-19 Healthcare Coalition was born. The overall mission is fairly straightforward. It is a private sector-led response that looks to pull together all of the potential stakeholders from a wide swath of companies, be them companies like Salesforce and Google, to healthcare systems like Partners or MedStar or Healthcare Associates, HCA, or Intermountain, to come together to try to identify projects, approaches to help preserve the healthcare delivery system and to save lives as quickly as possible. And MITRE's role in that is really one of facilitation and enablement. So my job in this coalition is really to pull together the various stakeholders that are interested in partnering together around a few guiding principles. And you can see them here on your screen. They're, again, very high level, and our attempt in building this coalition was one where we did not want to create administrative burden, people signing MOUs or things like that. This is really developed over email and virtual meetings such as the one we're on here, where everyone really agrees that what we're doing here is to benefit the country. We're not trying to create preferential advantage for individual entities, right? So a lot of these private industry companies are for-profit organizations that have commercial and fiduciary responsibilities to their stakeholders. That does not mean that we cannot come together to do work on a voluntary basis in a pro bono manner. So the work that is being done is all internally funded to each respective company. We're not paying people to be part of this. No one is paying to be part of it or paid to be part of it. The other really high-level guiding principles are we openly share whatever we can, meaning each company obviously has their own respective IP and the projects that they might be working on in confidence internally. But where we can come together to identify things where each one company might be working on a project that it might benefit them to come collectively together to address it synergistically, to share that. And then what naturally came out of that is work groups. So the coalition, as we began to onboard companies that were of interest in partnering together, we identified, here's a bunch of companies that want to work on contact tracing. Or here's a bunch of data owners or data custodians that want to work on data analytics and developing a rapid way of developing insight into COVID-19 related potential therapeutics or interventions. Or here's a group of stakeholders that are really interested in understanding things like non-pharmaceutical interventions or NPIs. And how can we pull those groups together into work groups that will meet twice a week, once a week, to focus on those specifically tailored questions that align with the guiding principles that you see here. And if you agree to those terms, these verbal agreements or written agreements in email suffice and you're in. And so over the course of, I will say, probably a couple weeks, the number rapidly grew of companies interested to well over 200. Initially, we began reaching out and had reach out from companies like Amazon and Google and Microsoft. And these are companies where, the C-level executives reached out and said, hey, we want to do something. Can MITRE help pull us all together? And our answer, as I had shared, was yes, we want to help pull big name companies like that, as well as startups and other companies that might not have the same kinds of resources, but have the same kind of passion, expertise, that others larger or mid-sized might have. And so what you see on your screen here, definitely not meant to be legible because it's so small, but just a small sample of the over now, I think the number is 947 companies that are official members of our coalition. They range again from companies like Epic and Cerner, right from the senior executives on down to companies like Healthcare Ready or SciOx, or health systems, again, like Mayo Clinic, of course, or University of California's health system, or other smaller coalition health system members as well. It's really meant to be as inclusive as possible, and it's meant to align with, as much as possible, the varying interests of each organization. And MITRE's role is to spin up those work groups where there's more than one company that has, or organization that has an interest in doing something. My job is to make sure that those work groups are manned and spun up. We have a website, of course. You can go to it at c19hcc.org. There's a way there if those on the line would be interested in participating and joining. You can find out more about what we do. We align our major work efforts in three broad categories. One is in clinical care outcomes. So this is obviously of interest to health systems and private industry stakeholders that are aligned with care delivery and affecting the clinical outcomes that matter the most, obviously morbidity and mortality related outcomes associated with COVID-19, or providing analytics and insight into those outcomes, right? So how do we develop therapeutics that might increase the time to intubation or decrease the time to extubation or help improve overall mortality? So working with EHR vendors and health systems together to understand how we can rapidly develop the insights into things like convalescent plasma, which has become a very large marquee project of the overall coalition, pulling together the lead principal investigators of the national IRB for the entire nation in convalescent plasma with health systems that are adopting the protocol in partnership with the FDA to transfuse patients and identify an army of donors. How do we do that? How do we pull together a Microsoft and an Amazon to stand up the websites that allow donors to click on a button to find out how to donate, and then partner with the researchers on the back end and the health systems that need the transfuse or the plasma to transfuse into the recipients brought from the donor centers to the recipient centers as quickly as possible. So that whole logistical supply chain, the partnering with the researchers and the website developers is a great example of the various subject matter expertise that need to come together in a large national scale project to affect outcomes like saving lives and driving down the time from donation to transfusion for real people. They have real stories behind them in ICU beds across the US that need an intervention that is beginning to develop the efficacy signal that it saves lives. Which then brings up the next point, is how do we then optimize and create speed with which to deliver that kind of insight that's needed, not just for the coalition members, but frankly for the nation. How do we help identify those therapies that are truly going to bend the curve in terms of saving lives? And so partnering with analytic companies to dive into that data, as well as to enabling the statisticians at the research centers to have the data to be able to do that insight, is really a critical next step. So we're also working in close partnership with the researchers to do that. Critical supplies is another example where the coalition members in the earlier parts of this pandemic in March and April, I'm sure everyone is aware of the PPE shortages that were an incredibly significant problem, certainly in the New York City area, but across the nation. And so how do we then pull together organizations like a Cardinal Health or manufacturers in China, or hedge fund managers that own portions of manufacturing companies in China, to prioritize getting boxes of masks from the docks and the shipyards of Chengdu or Shanghai in China to the Montefiore or Northwell or you name the health system in the New York City tri-state area. And so then that, again, supply chain of getting masks from on the other side of the Pacific to the East Coast, which is a huge problem, something I am not an expert in, but quickly came up the painful learning curve of how to go about that, partnering with our coalition to get those masks from point A to point B. And how do you QA test them, right? What are the organizations in our coalition that have the subject matter expertise to even do that? Is another example of work where we're working on critical supplies. And then the final one is public policy and overall guidance. So this is creating dashboards and insight that is actionable for the decision makers in state and local governments as we have begun to open up our economies and our society in various locales and go through the various phases, providing actionable insight based on things like positivity rate, overall testing numbers, at a granular enough level to inform the decision makers with the various data elements that they need to make the decisions. And so we have a freely available dashboard and a series of insights for non-pharmaceutical interventions, and as well as for the reverse MPIs, or opening up of one society, are available on our website. And that involves working with a bunch of very smart modelers and developers from across the nation and across the world, coming together, doing the number crunching on all the available data sets, and then producing the data visualizations. The goal being not to actually provide the guidance, but to give the data that is actionable for those that are in the policy decision-making roles of our society and government, to have the data at their fingertips to make that kind of insight. And so that's what our website's about. You can go there and you can really see those three areas that I just mentioned. So there's the decision support dashboard. And so this is to help inform policy decisions based on how, or using the data to inform policy decisions based on the data sets that I mentioned just right now. There are the standards for federated analytics. So this is how do we pull together the EHR systems, the health systems, rapidly come to an agreed upon process of doing queries in one's own data sets, and then performing those queries, developing those reports, and then aggregating those reports. And as I had mentioned earlier, sharing those reports with the researchers to develop the statistical power and then therefore insight on things like convalescent plasma, remdesivir, hydroxychloroquine, and others. Dexamethasone has now popped up. That is needed rapidly, and doing that in partnership with other researchers. And then the real-time MPI tracking. This, of course, was, I would say, more relevant and important as we were in the middle of the first wave, or certainly at the beginning of the first wave. And it will, I believe, become incredibly important as we look towards the fall time as well. But the real-time non-pharmaceutical intervention tracking, again, how do you close down society, and the appropriate quarantine and isolation recommendations and guidelines that are needed to help squash any potential second wave. And so you can go to our website and you can find those 3 clickable areas there. You know, what's next? You may begin to hear more about in the coming days about a coalition called The Fight Is In Us. This is a coalition that was launched, I think several days ago. We went public with Dwayne Johnson. You may know him as The Rock, or Samuel L. Jackson, and a variety of other ensemble celebrities that have joined our cause, essentially looking to enlist an army of potential donors who have recovered from COVID-19 to help accelerate the ability to save lives now with convalescent plasma for transfusion purposes, but also to help accelerate the manufacture and development of hyperimmune globulin, which is a more stable, refined version of the antibodies that are being found to help save lives. And so hyperimmune globulin and convalescent plasma, those researchers, those pharmaceutical companies, blood donation centers, plasma donation centers, a wide variety of coalition members are coming together under one coalition. The Fight Is In Us. Dwayne Johnson is our spokesperson, along with Samuel L. Jackson and others. And you can go there, thefightisinuS.org, to find out more as an example of some of the efforts that our coalition is engaged in. And I'll finally say that, you know, there's a lot of work that needs to be done. I mentioned earlier there's 900 companies, and that's not the end of it. If anyone is interested in joining, you can go to c19hcc.org. You can email us at c19hcc@miter.org to find out more. The onboarding process is fairly straightforward. We ask that you bring to the table what it is that you're interested in working on, what it is that you're interested in contributing to the effort to help solve and help see us through as not only a nation, but as a society through this pandemic. And that's all I have. Back to you, Jim and Nick.
Okay,
Thank you very much.
So,
Good afternoon, everybody. Happy Friday and happy Juneteenth. Hope you're having a wonderful day and we'll have a great weekend. Thank you, Jim, for recognizing my dad. He was an amazing person. I am the person I am today because of my parents. And this is kind of bittersweet because this will be the first Father's Day without him. As Jim mentioned, he passed on May 3rd. And he always liked to talk about his time with Patton. He didn't talk about the actual war itself. A lot of those men didn't. But he actually talked about his interactions with Patton. And when the movie came out, that's when the first time I knew that he was in Patton's unit. And he said that George C. Scott was an excellent replication of General Patton. So I am proud of him for that, and I am definitely proud of him for being the first African-American master electrician in the city of Philadelphia. With that said, let's go on to our meeting. Orlando, are you still with us? I know he had a meeting he had to run to, but wanted
I am. Thank you, Joyce, and thank you, everyone. Great. It's a pleasure to be here.
We wanted to give you a little bit of an overview of blockchain in healthcare today. And it is blockchain in healthcare today is a peer-reviewed journal. It's the first peer-reviewed journal that amplifies and disseminates distributed ledger technology, research, and innovation in the healthcare sector. It is the open access journal that facilitates sharing, discussion, and consensus building for a multidisciplinary market across a global community of stakeholders. We started the local chapter, the DMV chapter, Orlando and I, back in February of 2020. And we determined at that point that there's a lot of meetings that go on around the Washington, D.C. area, and we didn't want to overwhelm anybody. So we wanted to make sure that there were enough interesting topics and speakers and information that we wanted to share. So we determined that in every other month, protocol would be a good thing to do. And our first one, we had our kickoff in February with the CIO of HHS, Jose Arrieta. And then in May, we had, in April, we had another meeting. And then today is our next meeting. We have some great speakers today. Our first speaker is going to be Todd Hager and Fred DeVoe. And they are going to talk about the blockchain playbook. Todd Hager is the Vice President of Strategic Initiatives for Macro Solutions and has been working with Macro since early 2015. He provides leadership in strategy, innovation, quality, marketing, and practice development. Todd is the industry chair for the ACT-IAC Emerging Technology Community of Interest. In that capacity, he formed and is co-chair for the ACT-IAC Blockchain Working Group, which in addition to publishing a blockchain primer and the federal government blockchain playbook, executed 3 successful blockchain forums, hosting over 1,000 participants among them. He also helped to form the ACT-IAC Intelligent Automation and RPA Work Group, which is in the process of crafting a playbook. His partner in crime is Fred DeVoe. He is the Vice President of Prometheus Computing, helping to set the vision and strategies, and is the Prometheus Computing Program Manager for Prometheus NIST IDIQ contracts and the lead of the NIST Cloud Metrics subgroup, part of the NIST Reference Architecture and Taxonomy Working Group. Fred is also the co-lead of the ACT-IAC ET Blockchain Working Group. Todd and Fred, it's all yours.
Thanks, Joyce. We appreciate it. And it's great to have you and Orlando as part of the team. And I love what you're doing with this particular group too. It's been nice to be able to participate with you. So Fred and I have a presentation that we want to share. Nick, I'm not sure if that's ready to go or if you want me to go ahead and share my screen.
No, I'm the backup. I would rather you controlled it. I'm just here in case you have problems.
Okay, I may call on you. Okay, let me open this up and just make sure that we're all on the same page here. Okay. Okay. Let me open this and should be able to see it. Okay, very good.
That's working perfectly.
Wonderful. Thank you, Nick. Hopefully that's all I'll need from you right now. So thank you, Joyce and Orlando, for including us in today's session. Fred and I have worked long and hard with the Blockchain Working Group. In fact, Jose Arrieta was one of our founding partners in that. In fact, we celebrated our 3-year anniversary last month in May. Many in the healthcare community are represented within the Blockchain Working Group. So much of what we're going to be showing today was crafted with those folks in mind. And something that I think is important also here is that this, let me just show you the next slide here. There we go. ACT-IAC, just to clarify for those of you who aren't familiar with it, is the combination of the American Council for Technology, which is a government-oriented group, and that comes together with the Industry Advisory Council, IAC, which, as the name implies, is the industry counterpart. And the important thing for ACT-IAC is improving the business of government, and that they look to improve those outcomes through collaboration and partnership. So within the emerging technology community of interest, and there are a variety of other communities of interest out there, we've formed a series of working groups, one of which, of course, is the Blockchain Working Group, which we're going to talk about today. First thing that we did once we got going was there was such uncertainty. If you can imagine, 3 years ago, it's sort of light years away from where we are today in understanding digital ledger technology and blockchain. But back then, it was important for us to be able to get a level set for all folks, especially in government, to understand what it was, what it wasn't, and where folks are using it today and what they need to know. And we did that in what we called a primer. So we created a blockchain primer that got everyone up to the same page in terms of what is this thing, how is government considering using it, sort of dispel the scare. If you can think back 3 years ago, this Mt. Gox craziness and all that was in there, helping them to step away from the idea that this is not just a cryptocurrency, technology, that you can actually apply it to many other things. So the primer helped us to begin that conversation. And then from there, we went ahead and created a playbook. And the playbook format that we use, I've laid out right here on the screen, fairly straightforward. We use a lot of use cases to help bring it out. But the most important thing in the playbook is the very first section, which is the assessment. And that, as the name implies, is an opportunity for anyone, any agency, to really assess their potential use case and whether blockchain is appropriate or not, and if there are other alternatives that could be taken into account. And that's something, as when I hand the reins over to Fred, he's going to talk about some of this stuff, but I have to give a big shout out to Fred, because he actually, once we crafted this playbook and made it available in print form, and it is a living document, but as you can imagine, in print form, it doesn't always lend itself well to making sure you have. Fred went ahead and put it up on GitHub, and it's an online tool that's constantly evolving. And in doing so, he also put the assessment online. I think he's got a screen here to show that for folks too. As you can imagine, the assessment is fine to be able to take it in paper, but it's even better when you can do it online. From the assessment, we stepped into, if your use case does sort of pass the sniff test, the initial sniff test that's appropriate, now is your organization ready to be able to make this kind of a change? Unlike other technologies out there, as we all know, blockchain is going to have dramatic impact on the way things work within an organization. So we want to be sure that they understand that. I'm sorry, did I?
Todd, could I ask you to speak up a little bit? Some of the folks are asking for a little bit louder volume, or bring the microphone closer, please.
Sorry about that. Is this better, Nick?
Yes, it is. Thank you.
Okay. Sorry about that. So the next step, readiness, as I was describing, is helping to ensure that the organization follows the steps to be ready for taking on this new technology. As I mentioned, you can imagine that this is going to be very impactful and going to have tremendous change well beyond the technological aspects that organizations need to be ready for. Then after that, we do a selection. Here are the options available. Again, it's very important for us in an online environment to be able to provide up to the minute options. The landscape is changing daily and within blockchain. And then move into implementation. And this is not a full-scale implementation. This could simply be a pilot. This could be a proof of concept, getting folks comfortable with what it is and how it works. And then once that implementation is proven out, lessons learned, cleanup, and so forth, you can then move into integration, where you can put it into full production. You can integrate it with other systems out there, and all of the elements that are related to that in making sure that that is integrated successfully. I'm going to go ahead then and Fred, I'll handle the buttons for you, but I'll go ahead and turn this over to you, and you can help walk people through some of the snippets that we took out of the playbook, starting with the key activities that we've organized by section of Playbook. So go ahead, Fred.
Yes, so thank you. So part of the definition of the playbook was to try to establish a list of key activities that a group may want to take in order to go from should blockchain be used for a particular problem to how to integrate it into the greater organization or organizations. So we started looking at the different key activities and organized them based on the phases of the process, and also on a series of functional areas. So that we can look at, it's a little bit easier for a different group of of people to look at what are the key activities that, based on their role, they may need to pay attention to. So we organize that in 5 functional areas. So management, people, process, the technology, and then acquisition. We wanted to make sure that this playbook is not just only looking at the actual technology and what is needed to implement it, but also what are the other areas of the enterprise or the organization that needs to be addressed in terms of activities. Since this playbook was first focusing on the federal agencies, acquisition is also a big part of the playbook. Nothing really gets implemented if there is not some sort of acquisition at some point. Yes, as Todd pointed out as well, we intend the playbook to be used iteratively, moving from phases to phases. Each phase has some decision gate to ensure that we are not blindly going from one phase to the other, but we always try to ask ourselves, okay, do we have enough information? Should we keep on going, or should we iterate back, or even just stop there? And also from different stages of, I would say, the maturity of the project. Should we first do a prototype, then a pilot, then production? And even though we encourage the project to look at all the key activities, they may not be performed in the same granularity or details based on the stage that the project is in. But I think it's, at least in the federal space, always very important, for instance, to make sure that even at the prototype level, for instance, ATO requirement, like authorization to operate requirement in terms of security, are like at least thought of. Because if a technology can't be secured the way that it needs to be compliant, then should the time be spent to even look at it. So next slide, please. So for each of the phases, we've implemented a diagram that is then explained in more details into the playbook itself of again, what are needed in addition to the key activities in terms of input to the phase and output to the phase with the desired outcomes. So the input may be documents, maybe steps that needs to occur before, and after going through the different activities, what should be the minimum set of outputs that should be created in order to move to the next phase. I would say these are the examples and minimum sets. It doesn't mean that additional documents or artifacts cannot be, can be created. This framework is meant to be a baseline that can then be tailored or adjusted also based on the domain of use. It's possible that, for instance, the playbook used for supply chain or for healthcare or for other type of blockchain based development system may be slightly different. Next slide, please. So as Todd talked about, we published the playbook content into an online version so that it's more easily accessible. There is also options to add feedback. So anything that you guys, see missing or that should be enhanced or things like that, don't hesitate to send us some comments or feedback. Next slide. So as part of the assessment phase, we created a series of questions with some weight so that an assessment of the use of the technology can be performed with some scoring at the end. The idea here is we took the posture of making sure that these questions try to determine whether or not blockchain can be a benefit for the use case at hand, but also making sure that if there is already a solution that is trusted by all the participants and that already exists and everything is okay, maybe, I mean, do you need to build something new, or can you just use that? So we try to take into account that as well. Next slide, I think, back to you.
Okay, great. Thanks, Fred. Just actually looking at this slide, Fred, we probably ought to update it. I think we've had it out in other places too, but we're pretty proud of the fact that the blockchain playbook has flourished in the wild out there. And for folks who want access to it, in fact, we'll put a link in the chat for this if you want to be able to take a look at it online. In fact, I'm sorry, there's a link at the end of this as well too, so you'll see that in a moment. But many different organizations, frankly, around the world, you know, NIST has referenced some of this material in there too. They were helpful in providing us some information to create the playbook initially. So I do want to thank them as well too. But let me just go on to the next slide here. The blockchain working group has a variety of activity going on out there, and this is just one of the ways that we're looking to, you know, use some of this tooling that we've put in place to go out to agencies and help them assess and do their work if they're a little unclear about, you know, whether they're ready, or, you know, their organizations are ready, or they've adequately assessed their tools. We've done that. I know Fred and I have gone out to a series of organizations to help them understand where they are and how to evaluate their own use cases. So this is another activity that we can take on for folks out there interested in using the blockchain playbook. But we want to thank you for including us in the presentation. This is, as I mentioned before, those are the links to the both the print version and the online version of the playbook. We are grateful to be a part of this, and please, our email addresses are here too. Fred and I are happy to engage with folks out there who are interested in participating in some of the work that our team is doing. And if we can do anything to help spread the word, we're happy to do so. So we're happy to take any questions if folks have them.
Okay, thanks, Todd. I will scan if there are any questions. I'm looking for hands up or anything in the chat for those of you that are able to raise your hand. And by the way, that doesn't mean raising your hand in front of the video camera, because I can't politely see that in the 52 people that are on my screen currently. So. No questions.
Okay, great. Well, Nick, I'll go ahead and stop sharing and hand the ball back to you.
Okay. Thank you very much. Appreciate the presentation from you both. Joyce, do you want to introduce the next presentation? We may as well move along if Neil is ready.
Absolutely. Our next speaker is going to be Dr. Neil Wasserman. He is an adjunct professor in computer science at George Washington.
Joyce, it looks like you muted yourself.
Joyce.
Oh, okay. Sorry about that. Dr. Neil Wasserman is a managing partner and adjunct professor in computer science at George Washington University and managing director of Time Wave Analytics, LLC. He leads the design and implementation of healthcare applications of blockchain and other technologies. He teaches the first course on blockchain at GW and is involved in the creation of a multidisciplinary center for healthcare and blockchain in the Washington, D.C. region. He and his students have developed designs for application of blockchain technology to a wide variety of application domains, including satellite tracking, land registration, trade authentication, currency stabilization, IoT device access, and other areas. I give you Dr. Neil Wasserman. You're on mute.
We can't hear, we can't hear you, Neil.
And can you hear me now?
Yes,
Yes.
there we go. That's it.
Okay, all right. I had to switch microphones for some reason. There was a technical interruption. Anyway, it's a pleasure for me to be here. Thank you, Joyce, for involving me in this wonderful event. I'm happy to reconnect with Frederic on his activity and learn of the MITRE activities as well. Let me just say that the initiative at George Washington University has been quite exciting over the last years. We've had really wonderful students who have applied their creativity to developing blockchain applications and use cases in a number of different areas. And I think this is probably the first course in computer science that has a business emphasis. The students, of course, always ask me, can we get back to coding? And I say, well, you have to solve the problem. And that doesn't always involve the coding part of it. So we ask the difficult questions and get the students to think deeply about various problems. What I'd like to address is, and put it in the COVID-19 context, how COVID-19 is causing us to reassess how we work, play, interact, and learn. And I'm involved with an interdisciplinary team, which I'll talk about at the end of my presentation, that's developing an access control application to help reopen the university. And this also has a blockchain connection. But the main impact of blockchain, I think for me anyway, is raising the need for disciplinary connections that are new. We all find that we have to learn something about epidemiology and other disciplines in this new environment. What is an R factor? How can we reduce that? You know, why is it not important that we cut off flights from China when the virus is already present? Those kinds of questions become important for the survival and well-being of the population. But I'd like to focus on complexity management and the complexity challenges that information technology introduces and the potential impact of blockchain and what I call synchronized behaviors on managing that complexity. So the course that I teach also emphasizes these interdisciplinary connections, and I'm not going to go through all of these, but what's interesting about blockchain is the need to pay attention to other frameworks of thinking. And we need to kind of open our brains in new ways. The challenge that I'd like to speak to today and its relation to blockchain technology is the enormous increase in information that is inundating the both the technology world and the world of the human brain. And one statistic that I think is kind of interesting is that IoT data, the data produced by all the devices and sensors in the universe of our homes and schools, workplaces, transportation systems, is going to produce something like a data set that's 2 trillion size of the data store of the Bitcoin blockchain. So if we think of blockchain as a way of managing data, we have to put that in the context of the data that's actually being produced in the world. There are various initiatives to deal with this complexity. The NVIDIA GPUs, for example, now have up to 4,000 computational units. But the world is still more complex than human brains can address in a predictable way. And I like to use the American Diabetes Association guidelines, which consist of 35,000 words. And it's the task of the doctor to somehow translate these 35,000 words into actions that patients can actually take. And that isn't an easy thing to do. I gave a talk at the medical school at George Washington University on this interface between the data explosion and what doctors try to do for their patients. And I think it's a useful way of thinking of the brain that we have a tolerable level of entropy exposure, that is exposure to disorder in the world around us. And we have mechanisms that we can manage this toxicity, but it's the task of the medical system to make that possible, to make the human brain a useful organ for managing the data that is outside us and absorbed by our various sensory systems. So one of the things that I like to talk about is this kind of war between information producers, that is entropy generators, and the information reducers, that is the entropy controllers. And the medical industry kind of has both sides covered in a sense, that various ways of generating information via MRIs, image generation, sensor data, all the EHR data is really a larger data set than any patient can manage and interpret and act upon. So we have to pay attention to these entropy reducers, the information aggregators, validators, blockers, the search engines, the decision support systems that allow us to translate this overwhelming set of information into information that is actionable, that leads to the behaviors that make us all potentially healthier. So one way of translating this into the healthcare environment is to think of, okay, what is the set of producers of information, all the doctor's notes and scripts and diagnoses, all the history and ancestry and genetic data. I mean, the potential data set that's relevant to our health is huge. And then from the patient's standpoint, there's a kind of workload barrier. What is the capacity of the patient to actually interface with this information and manage that information? And so we need these mechanisms of information control, which include decision systems, regimens that regulate our behavior into routines and habits, and potentially blockchain, which, as I'll go into in a moment, is kind of an entropy reducing mechanism. So the mechanisms for entropy reduction include the consensus mechanism of blockchain. It takes a potentially disordered universe of potential blocks and agrees on a mechanism for replicating that as an accepted information set across the universe of servers in the blockchain network. We have standards that reduce implementation choices, and so reduce the available information choices that exist for managing information. We have governance processes, and replication and network effects is what I'd like to talk about now. So the perspective that I like to bring to the table is to understand how we introduce replicable behaviors, repetitive behaviors, habits, and network behaviors to manage the complex information universe that patients reside in. And we learn from other disciplines how this, in fact, can occur, from behavioral economics, from psychology, from anthropology, from information and systems theory. And one of the ways of looking at this is transforming our view of information produced in present time to information produced in terms of time cycles. So we have regular
behaviors that are replicated over time, over days, over weeks, over years, that allow us to ask the question, what is the minimum set of information that's required to manage behaviors in a population? And this becomes relevant to COVID-19 issues, because COVID-19 is really a behavioral management problem. So the transformation of information that's generated in the present time to information that can be viewed in terms of time cycles, what we do on a weekly basis, on a daily basis, on a monthly basis, is one of the ways that we regularize these behaviors and simplify the data set that's required to manage this information. And I divide these behaviors into these categories that are replicated over time, that are networked and propagated in a network, say from a central node, and that are propagated from multiple nodes. And again, this is a way of aggregating behaviors in a way that reduces the data set required for managing them. I'm giving you a several weeks course in 20 minutes. So I won't spend a lot of time on this, but we aggregate behaviors such as taking pills on a regular basis and synchronizing those behaviors across population groups that produces what we call population focused adherence. And if we look at what my image of the future world is going to be to manage these behaviors, we need a combination of these network behavior models, also the application of blockchain and artificial intelligence mechanisms, and also in conjunction with machine learning that can transform diverse data sets into interpretable models that may not be apparent at first. But blockchain plays a role in producing the consensus and simplifying the information that is accessible to the community. Moving right along, I'm trying to compress this talk a little bit to get to what we're doing at GW. So a couple of months ago, I was invited to give a talk at the medical school on behavior management and blockchain. And that initiated a collaboration with various people from the medical school to address the COVID-19 challenge. And we created this George Washington University COVID-19 working group, which started off as a kind of informal thing, but now has become a little bit more formalized. And I just want to recognize Dr. Neil Sika, Dr. Colton Hood, who are actual doctors in contrast to Professor Chen Zhang and myself, who are pseudo doctors. We have PhDs, but we don't like to call ourselves doctors. This core group, in the conjunction with a larger group at the medical school, has developed a mechanism for controlling access to facilities at GW. And we're starting off at the medical school, and that will be extended gradually to other facilities. But one of the things that I'd like to emphasize is that what this approach does, and it was developed very quickly with good input from the medical side and from the computer science side, is that it's universally accessible. It depends upon very simple technology, just a telephone number and web access via a cell phone. The mechanism, it replicates what has been tried and tested at places like Massachusetts General Hospital to identify whether patients or incoming people have symptoms, whether they have a temperature, although we regard temperature as really not a very useful diagnostic. But it's a way of controlling who enters facilities and what happens if they do have symptoms, so that they can be tracked, and if contact tracing is necessary, that can be pursued. The other thing that I think I'd like to just point out, and this is kind of an initial test that we've done, we have QR codes at various facilities that allow people to check their status and allow the security personnel, the guards at building entrances to understand what the status of people entering the facility might be. but we don't just check people, we check facilities. So Chen Zhang has developed computer models of airflows and such that can model the status of a facility in terms of how safe it is, in terms of airflows, how far people need to be, so that standards can be applied to not only people entering the facilities, but also the buildings. And this integrated system of QR codes and physical analysis of the facility and checking the status of people in the facility is what provides this way of managing the safety of personnel. And I'd like to also just point out that the existence of this application is a key component of the behavioral change that we want to instantiate in the university population, because it isn't just checking entry, it's encouraging the adoption of practices on the part of students, faculty, and staff that reduce the R factor in coronavirus spread, and hopefully reduce the impact, as some countries, not the US, some countries in the world have been successful in doing. And in order to manage privacy, we also have an integration with blockchain technology to store information that's associated with this application, but we try to separate medical data from data that's necessary to manage the COVID logistics. And so far, we've gotten quite an enthusiastic response on the part of the university. And we're looking forward to maybe collaborating with other universities and other people. We want to share this technology as best we can. I just want to leave you with one thought, which I like to share at the end of talks that I give, and that technology, just because it evolves doesn't mean that it's a good thing, as we've seen in Facebook and Twitter. And you know, evolution may progress, but it doesn't always progress in ways that we want. And but we hope that our COVID-19 initiative will in fact be successful, and that it will be a model for other kinds of behavior change in populations, which, as we all recognize, is the key to well-being in the sense of global health and our individual well-beings. So with that, I'll conclude, and I'll invite any questions, and also encourage future collaboration with anyone on the call. We're always looking for good ideas and interactions that are productive. We only know a small part of the potential universe of information and creative solutions. Thank you very much.
Thanks, Neil. Appreciate it. So for those of you wanting to ask questions, please raise your hand or put something in the chat box. I'll kick off because you said something that I triggered on, which was you meaning your site doesn't see temperature as a good screening mechanism. I'm interested to understand the thinking behind that.
Well, there are some interesting stories that Disney Corporation, for example, uses temperature as a mechanism for screening. And then if someone has a high temperature, they send them to an area where they can cool off, and then they test again, and the temperature turns out to be a normal. They found almost no indicators of high temperature as an exclusionary factor. So everyone passes. It's possible that if someone is running a high fever, that is something that should be checked, but the more common indicator are other symptoms that may not produce a high fever. So in my view, temperature has been viewed as a kind of comfort mechanism for people that want to implement screening techniques, but it isn't the most important diagnostic.
Thank you. If I could, I'll ask you to stop sharing so that people
sure.
appear if anybody wants to ask a question. I'll ask another follow-up around the app that you have. You said that you've developed, you have a whole program around that. Is that something that's available? Is that something that you're commercially trying to produce, or is it, what's the status of that?
Right now, we're aiming to collaborate with others that want to make use of what we've done. Our goal isn't really to make money out of this. I mean, we need some cash flow to sustain the activity. But as was indicated in the MITRE working group, our motivation is to solve the problem, not to profit from the challenge. So we're interested in entering discussions and are happy to share what we've done with others.
Okay, I'm going to pick up some questions. If you're typing in the chat, I'm assuming you don't want to appear on video and ask it, so I'm going to ask on your behalf. So Charles asks, what are specifically other symptoms?
Runny nose, diarrhea, chills, cough. There are, basically, if you're not feeling well, I mean, we have a list of check off the boxes kind of thing. But if you're feeling flu-like symptoms, under the weather, you should get tested and stay home and out of range of people that could obtain the disease from.
I'll add 3 additional ones that we're aware of. Diarrhea, loss of smell, and loss of taste are very specific. In diarrhea isn't, but the other 2 are specific in this particular instance.
Exactly.
Kathleen asks, how does this approach address the analytics of various population demographics?
The data that is collected is a source for analytics, and Dr. Chen Zhang is an expert in machine learning, and I've collaborated with him on a number of projects, including network analysis of professional connections and things like that. So the data source is a good foundation for doing analytics on population sensitivities, and that's certainly data that we would like to make use of. Blockchain plays a role in the anonymization of that data and the access to that data.
Fantastic, thank you. I'm not seeing any other questions in the chat. I'm not seeing any raised hands. I want to be cognizant of everyone's time. Oh no, here comes one. So Joe says, this is for Neil. I don't know why you said that, Joe, because that's as if it was somebody else. And I'm thinking, okay, I must call on Neil. This is Neil. So I'm just saying there's a lot going on this screen, if you'll forgive me, Neil. So what properties of blockchain help with COVID-19, token economies, anonymized contributions? What are the elements to that?
Yeah, so there's an application called GreenPass that has been developed independently of us that puts kind of access screening on a blockchain, and that's useful to provide potential privacy controls of data that is obtained in the course of the screening process. And as was mentioned earlier, it's very useful to do population analysis on the data without compromising sensitivities with regard to HIPAA and that kind of compliance. So there's a kind of interesting boundary between health-related data and COVID-related data. I mean, there's an overlap there, but we don't want to mix in the overall patient EHR record with the data that's necessary for COVID access support.
Okay, thank you. So Suniti asks, does a person have to show all the symptoms you mentioned, or do any of them indicate the need for testing? I'll happy to let you answer. I'm thinking, please.
Well, I think any of the symptoms would cause caution. And so we will have ways of responding to students and staff concerns. If they have a symptom, they can interact with a medical professional and see what the next step should be.
Okay, so Simon has raised his hand, so that means finally you guys get to see somebody different from me. Simon, would you like to ask your question and maybe even go on video?
Yeah, I'm actually on video, so it should show up.
Yes.
Thanks very much indeed, Neil. I really enjoyed the background. It's very, very helpful to put these things into context. Just that last question, the last answer that you gave with regard to the interlinking and the mingling of the COVID-related data with the EMR-related data, I'm wondering the extent to which you are prepared to explore linking those data sets for the purpose of deeper analytics.
I think in the long term, we have a phase 0, phase 1, and phase 1B, an evolving plan, to get more interesting as time goes on. But the medical school basically said, we need this now because our students are coming on campus. So we're looking at the simplest solution, and the simplest solution is not adding the complexity of extended medical data into the environment. There may be the potential of doing very interesting research to relate, showing symptoms, testing to more detailed medical history, but that involves the complexity that will take some time, and we don't want to delay the implementation of the core functionality of the system.
Fantastic. Thanks, Simon, for being somebody else that was on the video as opposed to me all the time. So always glad of that. I'm not seeing any more questions, so I'm going to pause for a second, ask Joyce if she would like to make any closing statements on this section. We'll maybe open it up for sort of more general discussion, but just on this piece. Joyce, would you like to close things out?
Thank you very much, Neil. We have one more speaker, Victoria Adams.
Oh, my apologies, gosh. That's a single line on here, so.
But thank you so very much, Neil. We appreciate your being able to participate today. Sounds like he is looking for additional collaborators, so please feel free to reach out to him. Neil, if you want to put your contact information into the chat box, that way the people who are participating on this meeting could reach out to you afterwards and lend some help or suggestions or some ideas. So our next speaker is going to be Dr. Victoria Adams. She has more than 30 years experience working in technology and public health. She is passionate about all things blockchain. She's led and created Consensus, the largest pure-play Ethereum blockchain firm in the world, public sector. She is recognized as a thought leader on blockchain health tech, gov tech, and fintech, and has been interviewed by numerous publications and spoken at more than 100 US and international conferences and meetings on blockchain and the public sector. She's the author of numerous articles and think pieces on blockchain. She's worked for the big 4 major consulting firms and has supported numerous federal government agencies since the mid-1980s. Victoria?
Yeah, isn't it always so embarrassing when people read out your things? You want to say, oh yeah, well, I'm pretty important. At least me dad thinks I am, Okay, so my name is Victoria Adams, and thank you very much, Joyce, and everybody to have me. I'm going to share my screen. Can people confirm that they can see my screen?
Yes, we can.
Yes.
Okay, so I'm going to say some controversial things because why the heck not? And let's see what we can do and have some discussion. So I'm going to talk about blockchain and COVID, and this is a project that I've been working on with the Value Technology Foundation, which I work over there part-time with. And we've been looking at different applications for blockchain within the COVID and what's actually been happening. And we've sort of taken a big picture view of what's going on. So I'd like to sort of go through this. So in this document, we're going to talk about how blockchain can be used, discuss the application of blockchain to the coronavirus, describe use cases, look at some factors holding back further adoption. So that's basically it. So let's start. So I think we can all agree that the pandemic is a world-changing event. It's an event on par with World War II or the Great Depression. We have rarely seen the level of global mobilization that we have seen since World War II that we are seeing now. It's greater than 9/11 and the war on terror in many ways, and it will transform how we live our lives. And I suspect it is the first of many such events we will see in the 21st century. If we think of the post-war consensus, post-Cold War consensus that emerged in the 1990s, we can see that it was broadly based around the free movement of capital, the free movement of goods and services, and the free movement of people. Now, all of those were mitigated by various trade barriers, by gross inequalities in terms of mobility, depending on what passport you have. But nevertheless, the world aspired to this. And after COVID, we are seeing some dramatic changes. Now, we've already seen some of those changes beginning with 9/11 and the resurgence of populist movements. After 9/11, the free movement of capital became much more difficult. And with the reemergence of populist movements in many countries, we've seen a radical disruption in terms of attitudes to immigration. But the pandemic is really radically disrupting our commitment to cross-border movement, the free movement of goods and services, and the relatively free movement of people. I've been doing a lot of work with airports recently, and I can tell you it is turning them upside down in so many ways. And we're seeing, and we can expect to see, much greater government involvement. So we're seeing really a new world emerge. This is on the magnitude, as we say, of the Great Depression, of the Arab oil price increases in the 70s, a tremendous thing. And I'd like to point out, this is really the fourth major epidemic / pandemic we've seen in this century. We've seen SARS, we've seen MERS, which were approximately of the same magnitude together, then the transnational epidemic of Ebola, and then finally we've seen COVID. And you know, as we think about this, there are other things happening too. We're seeing tremendous change in the ecological niches that different diseases are finding, and the spreading of diseases to new geographies. For instance, Zika and dengue started to be seen in Central America and spreading into the US. The emergence of different tick-borne diseases, the Lone Star tick, going from, which can carry tularemia, going from the southeast and is now being found in the northwest, are both caused by changes in how we live, in how we move, and in climate change, which is causing a migration of many tropical and subtropical diseases into latitudes further north. You know, just the tick-borne diseases alone are quite frightening. And of course, we do not expect COVID to be the last pandemic of this century. You know, the WHO created this, the World Health Organization created this placeholder for disease X, a disease that would be really devastating that is out there. You know, it could come from a zoonotic virus or synthetic viruses or bioweapons or some new respiratory virus like we've seen so far, or perhaps even drug-resistant bacteria. But if we think of 400,000 dead, this was of last week, I think, when I did this, we're thinking of 400 million dead, you know, a 10x or 100x increase of what we've seen, or 1,000x. We could easily see that. We could easily see that because the factors that have brought us these four changes, these four epidemics, these four emerging diseases in the last 20 years are still there. Dramatic urbanization, the encroachment on previously isolated environments. You know, if you go back to the emergence of diseases in the later Roman Empire, which was a facilitating event in its decline and the sapping of its resilience, we see the mixing of the Middle Eastern and European disease pools, with the African disease pool as probably being one of the things, for instance, that triggered Constantine's Great Plague in 405. So anytime we see this movement into different ecological regions and greater urbanization and trade, we should expect to see these. Global warming is going to bring new diseases into new settings that were previously not. And the whole ecological change that urbanization, development, and global warming is bringing together is likely to continually create this. We are living in the 21st century, in the era of global change and recurrent epidemics and pandemics. This will be the future. Now, I know it's pretty depressing, but it's not just the beginning of things. Now, blockchain can obviously help, and I think the key thing to think about with blockchain is essentially a technology that protects value chains, that takes from one point, and as something begins to move down that value chain and increasing value, blockchain can preserve the value from this. So we see this with the data value chain. We've had all kinds of things popping out talking about how we can ensure the legitimacy of data and its provenance. We can see this with goods. We've seen a great deal of evidence of this, and with assets. And we've seen how important these value chains are. Provenance really has come to equal value in a time of crisis, and it can be very difficult to determine. We've seen a lot of this with data as it's gone through, and we've seen even this with goods coming through. And as we move into a greater treatment phase and finally into a vaccine, we are likely to see thousands, hundreds of thousands of tons of vaccine moving around the world to vaccinate billions of people. And anytime you have that, you're going to have fraud, you're going to have tampering, you're going to have all kinds of problems. I would also say the degree to which that vaccine moves through as air cargo, there are major problems there in terms of ensuring the provenance. I do a lot of work in this area, and of the so-called cold chain, the pharmaceutical, the vaccine chain that's been moving through air cargo, until recently, approximately 40% of it was unusable by the time it arrived at its endpoint because of improper handling. So being able to ensure that it is being properly handled and tracked is very important. And I think we've all become more aware of the need for multiple points of validation and the need to move away from these silos systems that we see again and again. So potentially, as I say here, blockchain is a tremendous advantage and can be a critical tool in securing these value chains. Let's move on to the next one. Oops. So as I say, it's secure, it's transparent and accountable, it's smart, it's efficient. We should be seeing it secure in privacy, tracking supply, ensuring provenance, and electronic direct pay. But we're not seeing that. We're really seeing, when we look at this use of blockchain within the health space, and really within many other spaces, that we're not seeing widespread adoption. We're seeing pilots, we're seeing POCs, we're seeing very small limited tests, but we're not really seeing widespread adoption within the current COVID situation. And I propose that there are 6 reasons for this. To begin with, starting up on the right there, the emergency is not a good time to implement emerging technology. What we see again and again is folks going for simple off-the-shelf stuff. You know what Apple and Google were doing with tracking and using traditional methods of securing it. Faced with the problems we've had, introducing an entirely new system and having it integrate new technology and having it interface with the kinds of challenges that we are encountering here is really not a good thing to do from many people's perspective. Secondly, the technology still remains immature and major challenges remain. We still have challenges with scaling. We still have challenges with moving from, moving from proof of work to proof of stake. We still have challenges in terms of latency. We still have questions as to whether a private chain with a limited number of nodes is really any more secure than a simple single system, especially when you see the governance that is frequently implemented with those systems. We're still seeing a lack of cross-chain ecosystem standards, Interoperability is still an issue. We still need that chain of chains. And I would also say we still lack a compelling value proposition. The existing technology to many folks outside the community still seems to do the job. And we must develop a way of speaking to those outside the community that can really show the value of blockchain in a dollars and cents way, as well as something more than a theoretical, this helps with privacy. And I say theoretical because often people say, well, I've already got a system. It's not perfect, but it works. And our appeal is often to organizations that see privacy as a challenge and a problem, rather than to individuals who might see the benefit of it. Furthermore, we're really not seeing an observed preference for high privacy technologies amongst users. This is something I've done a lot of work on with behavioral economics, and what you're seeing is a stated preference of users for high privacy technologies, but a revealed preference, that is what their action shows, for almost any technology with minimal privacy. In fact, our behavior seems to show we value our privacy to a very small degree, whereas our stated preferences, we value it very highly, and we have to figure out how to address that. And there's difficulty obtaining buy-in. When you're, as has been said in this session so far, when you're working with blockchain, you frequently need the consensus of many stakeholders. This is a technology that demands deep organizational change, not just in one organization, but often in several ones. And again, in a crisis, that's hard to do. And finally, we're seeing a lack of funding. Many key players are under tremendous economic pressure. And this is not the time to spend money on things that you have anything else going on. We're going to see cuts in budgets for local governments. We're going to see cuts in budgets for major transit stations and airports and other folks that are involved. Hospitals are coming under pressure from declines in revenue that they're seeing from non-COVID activities. So it's difficult to come up with the time. So I would say a lot of pilots, a lot of POCs, but there isn't much widespread adoption right now, and that's quite understandable. But is that something that is going to last? Oops. And I would offer that perhaps, and this is some work that we've been doing at ValueTech and talking to a large number of players in this, that the pandemic might be bad for blockchain. The COVID economy that we're going to see, unless we see a V-shaped recovery, which I don't think many of us think is going to happen, we're going to see a reduction in spend by enterprises and government, and that may slow adoption. We've already seen that R&D in pharma research, R&D funding is shifting to pharma research, while IT spend seems a lot of it to be moving to AI and machine learning rather than blockchain. And as someone in this business, I've certainly noticed that over the last 6 months. There's what's been called the great unwinding. A number of startups are folding or dramatically cutting staff in the blockchain space. 30,000, the Washington Post quoted that 30,000 workers had been laid off within the startup space by the middle of March. and a number of venture cap firms are holding on to their money. We're seeing a great many smaller, innovative startups not making it through. There's also the phenomena of, in an ongoing emergency, you get decision overload. When you have multiple crises, the pandemic, the economy, it tends to overload decision makers. And when you're overloaded in your decision making, it tends to that you fall back on existing systems and quick fixes that tend to become permanent. So it takes the very courageous and the very level-headed decision maker who, faced with the multiple challenges that were coming on, the real threats to resilience that we're seeing here, to be able to say, wait a minute, is there a better solution, rather than how can I make what is working now work? And I think the framework of resilience is important to consider here. Resilience is your ability to bounce back. And every time an additional thing is thrown at you, that removes some of the energy that's there to bounce back. So for instance, with a pandemic alone, I have a certain amount of resources and energy to bounce back. But when I'm hit with that, and also with the economy being in the state it is, it's a double blow. It's going to reduce my ability to bounce back. And that is going to wind its way through all kinds of decision-making and direction. There's what we've been looking at, the authoritarian temptation. Crises always encourage states and governments to expand their power. Think of 9/11, think of World War II, think of any crisis you've been thinking. And the perceived success of China versus Western democracies may lead to a general diminution of privacy rights over public health. And one of the main things that we've been seeing with our technology is its protection of privacy. And maybe this won't be important so much more. There's been this framework that folks have been developing of type 1, type 2, and type 3 responses. Type 1 is, very collective in its response, and very having a very socialized view of privacy rights. And we've seen that in places like Taiwan, we've seen it in Korea. And the ability to collectivize those decisions and having a more social view of privacy and risk has enabled them to respond much more quickly. We've seen that in China too, this initial failure, but then the use of very harsh measures is more of a perceived success rather than the failure that's been observed in Italy and in Spain and in the United Kingdom. Now, it doesn't really mean, who's successful or not. It's what's the perceived thing. There is an authoritarian temptation. And I come back to this of a lack of a compelling value proposition. Despite numerous well-articulated value propositions, there's still an lack of understanding of the value of blockchain outside the community. I constantly have to explain this. Every time I go and speak somewhere, there are people who are hearing about this, relatively fresh, and they just don't get it. And it's a difficult technology to explain, as difficult perhaps as this. Now, I see people saying, well, we raised 250,000. You might have, but there are a great many people that aren't. There are a great many people that aren't. It's, as they say, the plural of anecdote is not data. And when you look at the data, there are some quite dramatic things. So, I propose to you, we're in a situation almost where we have to ask, is blockchain the technology of the future? And perhaps it always will be. After almost, 10 years of this, and I've been working in this for many years, we're not really seeing the killer app outside crypto. And crypto is not delivering on its possibilities. And faced with the pressure we're having here, we need to be thinking about these challenges and how we can overcome them. I would say there's the potential for an entirely new state formation to begin to move, a health security state, similar to as we've seen with national security, where we'll see an entirely different emergence of control and authority, with more resources being moved into the monitoring regulation of management of public health threats. And states which take a stronger, less privacy-bound approach to health security have been notably much more successful in dealing in the pandemic. And it's a real question of whether blockchain has a place in this world. Is it simply designed to become a truth management tool for authoritarian governments or a financial management tool? We just are not breaking through for some reason. So I would say let's sort of try and finish on a what next optimistic thing. You know, this is in our terms of the arrows here, the roadmap for recovery that we've seen different versions of. Slow the spread, revival and reopening, immunization and redistancing, and rebuilding and readiness. And in the short term, I would say this is not the time to build new things, but to repurpose any existing application that has already achieved some acceptance, and instead to be focusing on really our R&D and our thinking on the post-COVID world, on the new world that emerges after COVID. I really don't think that this is a good time to implement something new, unless, of course, as we heard from the previous speaker, we have very receptive, very forward-thinking organization. But when you have to reach those mutual agreements by governance, that's a very hard thing to do within a crisis like this. So I would say in the short run, we're focused on repurposing applications and rapid use case builds for very short-term cases that can be implemented, often on a single site basis. I would say in the longer term, we've really got to develop these new value chain applications for emerging post-pandemic world. That is how I think we should think about that. And to really develop this business case and focus on things like interoperability standards and addressing these technical challenges. One of the things that I come back to is we are sold on the technology, but outside the community, there is still a great deal of suspicion of the technology and a great deal of difficulty in understanding what the benefit is and being able to show that it is something that is doable in a time. For those of you who are old like me, I am in my 60s, if anybody is questioning, you can recall when the web first came out, and it was very difficult for people who weren't involved in the technology industry in the late 1980s and the 1990s to understand the value of this, to understand simply how it existed, where was it? And it took a long time for those compelling use cases to sink into both enterprises. In enterprises case, really not until the end of the 1990s, and in individuals' cases, slowly accepting it with applications like AOL. But it took a long time to get there, and a long time for people to perceive value that was evident to many of us from the beginning. And we should expect that slow beating back and getting there. And we need to figure out what the language is for that. So I hope I have been controversial. I hope that people have lots of criticisms and lots of things to say. And please, let's go on to questions. By the way, if you're wondering what Cadwin block is, it's Welsh for blockchain.
Oh, I felt that Welsh bit in the Cadwin name.
There we are, special, aren't we?
Oh, very special.
Nobody who isn't British is getting this at all.
There's a few of us on here. I know Simon's smiling. You can tell that lilting Welsh accent.
That's right. So, questions?
Thank you very much, Victoria, or Tori, as I see in your final slide. As before, Kevin, I see you're raising your hand in an unusual form, so I'm going to allow you. Please unmute yourself, ask away.
Thank you, sir. Yeah, no, I can't find the raise hand for whatever reason. I see the reactions. I think I know where it is normally, but and it's eluding me. But anyway, I wanted to say thank you. And as a Terry Pratchett fan, and the We Free Men, the Whaley Whaley, if you haven't read that, for the Scottish people here, it's a wonderful, wonderful book. And that was my only introduction to some of the jokes you guys were going through. So you, Tori, and Simon can have your private joke without us, I guess. But Tori, I wanted to say thank you. Didn't really hear too much that was controversial. So my question really is like, what did you think was controversial there? And my one minor comment that I would say that's really helped me talk to people about blockchain is just separating cryptocurrency from blockchain from distributed ledger. I think a lot of people really can get the concept that distributed ledger technology has a real future to change a lot of things, but people just kind of assume, I think, that blockchain just means crypto, and because of the cryptocurrency, they don't see that going anywhere. Anyway, what was controversial in your prezzo, which I loved?
The controversial things I think that I've been hearing is from a number of folks that says, well, actually, the capital market is still, and I'm sure it is for some. Also, the feeling that there are more things moving out into production. I'm very skeptical of that. I haven't seen that. So those are the things that I normally get pushback on. I would say in terms of crypto versus blockchain, yeah, that's something, that's the whole thing. I start out, my sort of blockchain 101 is, here's a bunch of myths. And the first one is crypto isn't blockchain. Blockchain is the underlying technology. I think that specific use cases in terms of being able to get people to understand it is often hard because folks start to think, well, wait a minute, I've got to let go of power and authority. I've got to start sharing this. And the paradox of by sharing control, I gain control, I gain security. It's difficult, I think, for many enterprises to grasp. And when I'm talking to enterprises, I find you really have to get down to dollars and cents. And the fact that we haven't been able to do that successfully yet. Deloitte's got an excellent business case looking at potential savings from transaction verification. And I urge people to search for that because it really does give some dollars. But things like provenance and supply chains, it's actually quite difficult to make the business case. For instance, I was speaking with some folks at a major airline manufacturer, and their response when I talked about provenance was, you don't get into our supply chain unless we trust you. And we can track you through everything. And if we can't control that, and if we can't track you, then you don't get that supply chain. And we're the big dog on the town, so we can do that. So it's a difficult thing. And often I found it's easiest to sell when you're talking with groups that have that are coalitions, or some group that has come together and doesn't have a dominant partner, and that's when you can get most of the ease to understand what's going on here. But great questions.